Hi, Dr. Clare. Do you want to just tell us a little bit about your herbal medicines course for common health problems?
Sure. First of all, I'll introduce myself. My name is Dr Dilis Clare. I'm a GP and medical herbalist. I trained in University College Dublin and then went on to have a very fulfilling role as a GP in North London, where I had the opportunity to do a BSc in Herbal Medicine. That led me to returning to Ireland, and I've been working as a clinical herbal medicine physician since 1999 at my clinic in Galway. When I came back to Galway, I really had no idea whether people were interested in using herbal medicines as a primary part of looking after themselves and their family. And much to my surprise, the clinic and the dispensary elicited a huge amount of interest. However, as people came into the shop, they weren't looking for individual herbs. They were looking for a solution to their problems, which made it quite difficult for the dispensary practice staff to really know how to gear them and how to deal with problems rather than requests for individual herbs. Because of that, I blended blends for common complaints to assist the staff. It was a very practical solution at the time. And that made life easier for a couple of years, until eventually one of my customers came in and said, well, nobody else knows that they're there. And that, of course, was you, Ruth. And we've been working together ever since. I agreed that it was a good idea, but with my level of technical knowledge, nothing really happened, and then nothing happened for another 3 months or 6 months, until eventually one day you came in with all of the labels on, I can't remember whether it was a disc, floppy disk or a CD. It was at that time in history. It seems ancient now, and we're still using those labels, and we had lovely labels and we put them on the shelf, and more people got to know about them. So the whole thing to do with blending herbs for common conditions grew in a very organic way. Several years later, some of the pharmacies in Galway asked if they could stock the herbs, and I thought no problem with sharing the good news and having a choice for people. Some of the people who are most interested in the medicine I practice are in fact pharmacists and nurses, which doesn't surprise me in the least, but that was how the herbs kind of grew legs, and the blends got to the attention of more and more people. So that's the history of how the blends of herbal medicines that I'm going to teach you about, and that you will have all of the in-depth information of background that you can cross-reference for yourself, and see if you find them useful, to learn more about them and to be able to advise other people as to how to use them.